Good day, everyone. We are Team Phillies, and today we will be talking about food security and nutrition, focusing on FRAC, which stands for Food Research and Action Center. So let's begin. Our team is composed of three wonderful members: Maria Estrada, Andrea Rendon, and yours truly, Danny Deason. And this is what we're going to be talking about. We will be discussing why food and nutrition security is a growing community health issue and why no single organization can solve it alone. We'll introduce our proposed coalition, explain how collaborative partnerships can create sustainable solutions, discuss the roles of key stakeholders, and conclude with recommendations for strengthening food and nutrition security through collective action. Ask you a simple question. What did your morning look like today? For many of us, it started with breakfast or a cup of coffee without a second thought. But for millions of individuals and families, every day begins with uncertainty about where their next meal will come from. Food insecurity is about much more than just hunger. It's influenced by factors such as income, housing, transportation, education, and access to community resources, what we know as the social determinants of health. As a PBS documentary, We Are Where We Live reminds us, improving health requires more than healthcare alone. It requires stronger communities working together. Think about the child who struggles to concentrate in school because they don't have access to nutritious meals, or the adult whose health is affected by a poor diet and limited food choices. Food insecurity impacts not only individual health but also education, workforce productivity, and the overall well being of our communities. Next, let's hear a short clip from FRAC's perspective. You can find the whole video on their website.
It's a unique outrage that a country this rich has such high levels of poverty and hunger in a society which has the wealth and the resources and the food to eliminate hunger tomorrow.
Hunger is a justice issue. It's not only providing food, but to look at the why. What are the root causes, and what do we do to go after those root causes?
In 1970, for a very substantial portion of the people who were clearly poor and were hungry, there was nothing. And what's really important, FRAC played the key role in creating that infrastructure.
Hunger is not just a moral issue, it's a practical issue. It's hard to overstate how fabulous these nutrition programs are because they're directed at the neediest families, the neediest communities. They improve people's health, they lower health costs, they improve kids' learning. When people see them actually working, they understand how hugely important they are.
Now we know the why. But as we continue, it's important to distinguish between food security and nutrition security. Food security simply means saying, I have enough food. Doesn't matter what kind of food, I just have enough food. I'm not hungry. While nutrition security goes one step further and says, I have healthy and nutritious food that support long term health and well being. Research shows that communities with limited access to nutritious food experience higher rates of obesity, diabetes, hypertension, cardiovascular disease, and other chronic illnesses. Simply having enough food isn't enough if healthy options remain inaccessible or unaffordable. For example, many lower income neighborhoods have fewer grocery stores that offer fresh produce, causing residents to rely on convenience stores or fast food restaurants because that's all they have around. That's all that's accessible. This illustrates why improving food and nutrition security requires addressing the broader systems that influence food access, not just hunger itself. Ultimately, achieving food and nutrition security is a shared community responsibility. Creating healthier communities means ensuring that healthy food is both accessible and affordable for everyone. Now, the question is, can FRAC do it all alone? The answer is no, because one of the biggest lessons we've learned throughout this course is that complex community challenges cannot be solved by one organization alone. Gardner and Matviak remind us that organizations create greater impact when they intentionally collaborate. For example, a healthcare organization may identify a patient experiencing food insecurity, but it cannot solve the problem by itself. Schools, Food banks, community organizations, government agencies, and healthcare providers all contribute different resources and expertise. When these organizations work together, they create stronger and more sustainable solutions than they could individually. The Food Research and Action Center, or FRAC, is a great example of this collaborative approach. By bringing together partners across multiple sectors, FRAC demonstrates how collaboration can improve food and nutrition security while creating lasting community impact. The Food Research and Action Center, or FRAC, is a great example of collaboration in action. FRAC brings together healthcare organizations, schools, community organizations, researchers, advocates, and government agencies that all share the same goal of improving food and nutrition security. For example, FRAC works closely with the USDA, school districts, and national education organizations to strengthen programs like SNAP, WIC, and healthy school meals. By working together, these partners create stronger, more sustainable solutions for the communities they serve.
Hello, my name is Andrea Rendon, and these are the slides that I will be presenting for our group. So now that we've discussed why coalition is necessary, the next question becomes, what makes a coalition successful? Our research found that successful coalitions don't happen simply because organizations agree to work together. They require intentional collaboration. First, every partner must share a common mission and agree on the same long-term goals. While each organization contributes something different, everyone should be working toward improving food and nutrition security within the community. Second, trust is essential. Organizations need to communicate openly, share resources, and remain transparent about their responsibilities. Gardner and Matviak emphasize that collaboration is most successful when partners intentionally build trust, learn from one another, and remain accountable to the coalition's shared purpose. Finally, every organization has a designed role. Healthcare providers may identify community needs, schools can support children and families, food banks address immediate food access, nonprofit organizations coordinate services, and community members provide valuable insight into local challenges. When each partner understands their role and works together toward a shared goal and vision, the coalition becomes much more effective than any organization working alone. For example, if a school identifies a family experiencing food insecurity, the coalition can quickly connect that family with healthcare screening, SNAP enrollment assistance, local food pantries, and nutrition education. Instead of navigating multiple organizations independently, families receive coordinated support through connected community partners. Of course, building a coalition isn't without challenges. One of the biggest obstacles is that every organization has its own priorities, funding sources, and ways of operating. A healthcare organization may focus on improving health outcomes, while schools focus on student success, and food banks concentrate on food distribution. Although everyone supports the same overall mission, these different priorities can sometimes make collaboration difficult. Our research suggests that successful coalitions overcome these barriers by establishing clear goals, communicating regularly, and creating shared accountability among members. Open communication helps build trust, while continuous evaluation allows organizations to adjust their strategies as community needs change. Another challenge is sustaining collaboration over time. Partnerships require ongoing commitment, flexibility, and shared leadership. By continuing to learn from one another and remaining focused on their common purpose, coalition members can create long-term improvements in food and nutrition security rather than temporary solutions. The literature also suggests that many coalitions struggle not because organizations disagree with the mission, but because they lack consistent communication, clearly defined roles, or methods for evaluating progress. Successful coalitions continuously assess outcomes and adjust strategies as community needs evolve. Understanding the issue is only the first step. The real opportunity lies in bringing organizations together to create lasting solutions through collaboration. With that foundation in place, I'd now like to introduce the coalition our team selected and explain how these collaborative principles come together in practice. FRAC's mission is to help improve the nutrition, health, and well-being of people struggling against poverty through advocacy, partnerships, and equitable policy solutions. Their work goes beyond providing immediate food assistance by focusing on long-term improvements that address the root causes of hunger. Unlike organizations that focus primarily on emergency food assistance, FRAC also works at the policy level to influence legislation, strengthen nutrition programs, and create sustainable systems that improve food and nutrition security over time. The coalition's goals are to strengthen nutrition security by advancing policies, supporting community partnerships, and promoting solutions that improve access to healthy food. FRAC works incredibly to create lasting systems change that improves both for food access. FRAC's vision is a society where all individuals have consistent access to nutritious, affordable, and culturally appropriate food. This vision reflects the coalition's commitment to creating sustainable solutions rather than relying solely on short term interventions. Thank you, and now on to my colleague Maria.
FRAC's effectiveness is strengthened by its broad networks of stakeholders and partners. The coalition brings together local and policy leaders who all share the common goal of reducing hunger. FRAC also collaborates with schools and healthcare organizations to expand food access and strengthen nutrition security by combining research and community engagement. These partnerships increase the coalition's reach and impact. This collaborative approach allows FRAC to connect policy efforts with communities' lived experiences. Each stakeholder is contributing unique expertise. Healthcare organizations identify community needs, schools connect with children and family, researchers provide evidence, government agencies influence policy, community organizations coordinate services, and advocates raise awareness. Together, these complementary roles strengthen the coalition's overall effectiveness. As you can see on the slide, how all the collaboration efforts are put together and how they work well. On this slide, we're going to explain our theoretical framework. This project is guided by social capital theory and collaborative governance, which explains how partnerships improve coalition effectiveness in addressing food insecurity. Together, these theories explain not only why organizations choose to collaborate, but also how those collaborations become more effective over time through trust, shared leadership, and coordinated action. Social capital theory shows that trust, communication, and strong relationships among organizations help improve resource sharing, reduce service duplication, and create more responsive support for communities. Collaborative governance builds on this by focusing on shared leadership and accountability among multiple sectors. Together, these frameworks demonstrate why collaboration is essential to addressing complex public health issues such as food insecurity. They help explain how FRAC strengthens partnerships, aligns shared goals, and promotes long-term systems change that improves nutrition equity. Now we're going to place our evidence from literature. The literature consistently shows that coalition-based collaboration is essential for improving food security. Research demonstrates that community engagement and shared resources lead to more effective solutions. Studies emphasize the importance of food justice, showing that food insecurity is influenced by broader social and structural factors, rather than food availability alone. Overall, the evidence supports FRAC's collaborative approach by showing that lasting improvements in nutrition security require community partnerships and coordinated efforts across multiple sectors. Across the literature we reviewed, one common finding consistently emerged. Organizations achieve greater impact when they coordinate their efforts rather than working independently. Researchers recommend cross-sector partnerships because they combine diverse expertise, improve resource sharing, strengthen community engagement, and create more sustainable solutions than isolated interventions. In conclusion, food security is a grand public health issue influenced by social, economic, and environmental factors. FRAC demonstrates how coalition-based collaboration can improve nutrition equity by bringing together providers and policymakers to address both immediate needs and long-term solutions. Although challenges do exist, strong leadership and shared decision-making help coalitions remain effective. Ultimately, lasting improvements in food security require continued commitments to creating healthier communities. This project reinforced one of those central themes, of course. Meaningful community change depends on collaboration. When organizations align around a shared mission, they can create solutions that are more sustainable, equitable, and impactful than any single organization could accomplish alone. Thank you so much for listening to our presentation today, and looking forward to hearing your feedback.
On behalf of the team, we want to thank you so much for your time and for listening. Hopefully, you find this information useful. Have a great day.